Hi, my name is Dr. Jordan Carqueville. I'm a Mohs surgeon and cosmetic dermatologist. Today, I'm going to walk you through a case of a before and after for a patient that we performed skin cancer surgery on, also known as Mohs surgery. I'll walk you through the patient's experience, the treatment we chose, and the results. So let's get started. Let's start with why the patient came to see us. The patient had a skin cancer called basal cell carcinoma on their nose. The patient was very nervous because surgery on the face can be scary. This was a skin cancer, a basal cell carcinoma that needs to be treated or else it will continue to grow locally. So our job as dermatologists and dermatologic surgeons is to evaluate the condition and discuss what is the proper, standard of care treatment for this patient. And in this situation, the best treatment is Mohs surgery. Mohs surgery is a skin-sparing technique to remove skin cancer, taking the smallest amount of skin. In areas such as the central face, the nose, that's an area where you don't want to take too much skin. So our patient came in and we outlined the area. You can see where there is the purple marking pen. That's where we define where the skin cancer looks to be physically when we look at the skin. Then we numb up that area and we take a layer or a piece of skin that we have outlined and we bring it to the laboratory in the back room. The laboratory then processes that tissue, and then I look at it under the microscope to see if there's any skin cancer left. Sometimes it can take 1 or 2 layers, even more than that if it's a big skin cancer. In this case, it took a few layers. The next photo that you'll see is the defect where the hole is after we've taken the skin out. When we look at the defect or the opening where we remove the skin, it can be challenging to close in certain areas. So in this location, because we didn't want to pull from the eyelid area or pull too much of the cheek, it's difficult to move that skin. I decided to perform a flap. This is called a rhombic flap, and it's using skin from another area to move it and close that defect. In this case, I took the skin from the glabellar region, so in between the eyebrows. There's some redundant skin right here, so you can remove a little bit of skin and rotate it down to close that defect. The procedure generally is painless because we're using local anesthesia. We're talking the whole time. Afterwards, there might be a little bit of soreness when that numbing wears off. So we usually tell our patients, take a little bit of Tylenol, and that should do it. It takes a few days of rest after one of these procedures. You don't want to bleed into the flap or disrupt that skin that's trying to live in a new home. So we recommend relaxing, just taking good care of yourself for 3 days, and preferably no vigorous exercise for about a week. We do leave a good dressing on you for at least 24 to 48 hours. And then after that, you can remove it and clean it with some gentle soap and water. The stitches come out in about 1 week. After the stitches come out, the skin will continue to heal. There's not much that you need to do other than good sunscreen, apply a little bit of Vaseline. We do offer lots of laser treatments afterwards to help blend the scar. This patient did not need that. She healed really well. The face has a really good ability to heal nicely. Sometimes we have to help it along with other interventions, but not in all cases. Typically, one would expect about 6 weeks to really have that skin heal and recover. But it can take up to 6 months to a year even to fully heal and have that scar consolidate. If you are a patient with a skin cancer on your face, the standard of care is Mohs surgery. And so it's important to consult with a dermatologist or a board-certified Mohs surgeon in order to go through those procedures with you. If you found this helpful or interesting, feel free to subscribe to our channel to see some before and after discussions as well. Feel free to drop any comments or questions below. Thank you.